who are the ACA marketplace enrollees? Look at this. The plurality are actually Republicans. Republicans are more likely to use the marketplace than Democrats are at 45%. Democrats at 35%. Then you get independents at 20%. But the key nugget here is Republicans are more likely, in fact, to be the enrollees in the marketplace than Democrats are. And the majority of the enrollees, 57%, are in Republican-held congressional districts like Marjorie Taylor Greene's. So what we're seeing here is it's not actually Democrats who are the only ones who are taking advantage of Obamacare or the Affordable Care Act. There are a lot of Republicans, and the clear plurality of those who are the marketplace enrollees are actually Republicans, and the majority of them are actually in Republican-held districts. And that is why, Sarah, you're seeing this debate really divide Republicans and really unite Democrats.
Do you support Obamacare or the Affordable Care Act?
Affordable Care Act.
And why is that?
Well, I mean, I'm not the biggest fan of Obama, so I don't support him in the Obama things that he's got going on. I'm actually really excited for President-elect Donald Trump, so.
Right. So you don't like anything Obama does, and you prefer the Affordable Care Act?
Absolutely.
Do you support Obamacare or the Affordable Care Act?
I support Obamacare.
So if you were a senator and you could vote today, you would vote to keep Obamacare instead of the Affordable Care Act?
Yes.
Do you support Obamacare or the Affordable Care Act?
I guess the Affordable Care Act.
And why do you prefer the Affordable Care Act over Obamacare?
I'm not really sure. My girlfriend supports Trump, so I go with whatever she says.
What is the main difference between Obamacare and the Affordable Care Act?
One is you pay, and then the other one is Obama pays for you.
Right, Obama pays, pretty big difference.
Pretty big difference.
I believe that Obamacare, the premiums are too high, so people end up paying more.
Right.
So I believe in the Affordable Care Act.
And so the Affordable Care Act is more affordable than Obamacare?
Right, correct.
Right.
Which is obvious based on the name.
It's in the name, right.
Right.
Why do you like the Affordable Care Act more than Obamacare?
Because I don't like Obama.
But you like the Affordable Care Act?
Yeah.
What if I told you Obamacare and the Affordable Care Act are the same thing?
Here's my opinion on health care. I try to encourage people on the right to take people on the left at their best possible meaning. When they say, we want free health care, you mentioned this before, nothing's free. But I know what they mean when they say that. And I think if you take them at the interpretation that in the richest country in the history of the world, it probably is unethical to tell people they can be as healthy as they can afford to be when we have the resources to make that not the case, when we have the resources to make sure that everybody has a better chance. I mean, there's nothing more patriotic than taking care of your neighbor, in my opinion. And you can, if you're a religious person, obviously there's religious implications there as well about taking care of your neighbor and such, no matter what religion you're a part of. I think it's unethical for us to look at our neighbors suffering and be okay with that because of our politics. So that's a good starting point. The problem is, how do you solve that? And private industry is usually better than the government at doing things, but also private industry has given us the largest lawsuits in the history of human beings through the pharmaceutical industry, right? So none of this stuff is particularly foolproof. We've got a big problem right now where we're kind of operating to the lowest common denominator while allowing the private sector, who should be solving this problem, in my opinion, be predatory towards the consumer.
If you buy your own health insurance and don't get it through work, Medicare, or Medicaid, then you need to watch this video because your insurance might be multiplying. See, the government help that's been keeping your monthly payments low, whether you realize it or not, is known as the Affordable Care Act, also known as Obamacare. And that help might be ending soon. If it does, millions of people could see their health insurance bills multiply overnight. This especially affects people like freelancers, small business owners, part-time workers, early retirees, and anyone who's self-employed, basically anyone who buys their own health insurance. And here's how to know if this impacts you. If you've signed up for health coverage on healthcare.gov or your state's marketplace, or if your bill shows a premium tax credit or subsidy, you've been getting federal help to make your monthly payment more affordable. Most people who have it don't even know they have it. So I would encourage double checking. Now, if that help goes away, your monthly cost could double or even multiply several times over. For example, if you're paying $100 a month right now, that could jump to $500 or more per month next year for the same exact coverage. When that happens, a lot of people will have no choice but to cancel their plans, and fewer healthy people in the system means higher costs for everyone left behind. It's a domino effect that drives prices up and coverage down. I've talked to some people who said, if my insurance goes up even $50 a month, I'll have to skip my medication. Listen, that's not politics, that's survival, okay? This fight over Obamacare subsidies is one of the main reasons the government is shut down right now. Lawmakers are arguing over whether to renew this funding while open enrollment starts November 1st. If they don't act soon, millions could wake up with massive premium hikes in 2026. Here's what you can do right now, though. Go to healthcare.gov or your state's marketplace and check your account. Look for premium tax credit. If it's there, this affects you. About 20 million people have it. So, but just double check. But bottom line, if these Obamacare subsidies expire, your monthly health insurance payment could double or even multiply several times over. So check your plan, share this video, and stay alert because this could hit a lot of families hard. And if you think people were being impacted because of food stamps being taken away, and y'all see what's going on with Walmart right now, imagine if health insurance gets taken away from many people, what's going to happen in the hospitals. It can get crazy. So see you in the next video.
Excuse me, Senator Collins. My name is Andrew. I'm a constituent of yours. I was hoping to talk to you about some of my concerns about the ACA. Hi there.
Hi there. How can I help you today?
My name's Andrew. I'm a constituent of Senator Collins, and I was hoping to talk to her about the Affordable Care Act. My name is Andrew Volk, and I'm a Mainer, as well as a small business owner and a father of two. And I'm here today in Washington, D.C. to ask Susan Collins why she is failing small business owners and why she refuses to extend the tax credits for the Affordable Care Act. Yeah, I mean, my biggest concern is seeing those tax credits expire. And, you know, I'd love to understand where Senator Collins stands on that. If she's, you know, I think that with the uncertainty in the economy, with the uncertainty with the government shutdown and the tariffs, there's a chance that those tax credits expire, and for, in my opinion, not very good reason.
So interesting.
Sure. I haven't seen Senator Collins fighting the administration. I haven't seen her fighting for Mainers, and I haven't seen her fighting to bring down the costs that small businesses in Maine experience every day.
So my boss has said that she's concerned about the impact.
Sure. Rightfully so.
She's also concerned about the fact the government isn't opened up.
Yeah.
And she's expressed concern about the rising cost of healthcare as well.
Sure.
So all those things working together.
I mean, I understand the concern. I guess from my position, I don't see the action. I just got out of Senator Susan Collins' office trying to meet with her and was not able to. Clearly her aides saw that I was waiting for her and did everything in their power to make sure that she was able to avoid me. Excuse me, Senator Collins. My name is Andrew. I'm a constituent of yours.
Hi.
How are you?
How are you?
Great. How are you?
Good.
I was hoping to talk to you about some of my concerns about the ACA. I'm a small business owner and a father of two.
Or extending the tax credits.
Okay. Do you have just a moment to chat?
Thank you. I'm sorry. We got to go vote.
Have a great day, Senator. I'm so sorry that I'm just trying to reach you today. She wouldn't make time to meet with a constituent like myself, but instead was getting lunch with President Trump and cozying up to the administration. She doesn't hold town halls, she doesn't make time for her constituents, and she doesn't seem to be taking any action to assist Mainers, small business owners, and those on the Affordable Care Act. Oh, she exists. I've never seen her in 20 years.
Did you know that 45% of the individuals that are enrolled in the Affordable Care Act, so affordable health care, are Republicans? Democrats are fighting for Republicans who cannot bother to educate themselves that they need this type of advocacy. They will literally be the hardest hit if what Republicans want to do go through. And honestly, the only way these individuals are going to learn is if we are honest with them and just tell them, like, hey, if you're on Medicare or Medicaid, or you fall under the affordable health care in some way or another, this impacts you. And that's what we have to do. And honestly, it's like just a reminder of, I recently saw a video where people were asked if they preferred Obamacare over the Affordable Care Act. And people just kept saying Affordable Care Act because they didn't like Obama, but they didn't understand that it's the same goddamn thing. Like, the hate that some of these people have just because of someone specific, for whatever reason it is just so insane. And I know it's like beating a dead bush, but for the love of God, please educate those and tell them that it's Republicans who will be impacted the most if Democrats don't get their way with a negotiation with Republicans.
The Democrats created Obamacare. They're the ones that created a subsidy with an expiration date.
Pyman, are you okay? Because you just said that the problem with the Affordable Care Act is that the Affordable Care Act was created. So Pyman, the demon of the house, was busy at work today giving out more misinformation because, yes, the Affordable Care Act was created by Democrats and there's tons of improvements that can happen to it, but the subsidy expiration date was voted on by both parties in the House and Senate. Also, the subsidies affect everybody. If the Republicans actually cared about the American people and solving this problem and wanting to end the government shutdown, all they have to do is add one sentence to their clean CR, and that's that the subsidies will not expire. That's it. One sentence. You know, Pyman, I am going to give you your roses, though, because I guess everybody deserves their flowers when they have the chance to get them. The mental gymnastics that you did to make this make sense in your own head and then get in front of cameras and say that out loud, that should be studied.
I love when stuff like this happens because Mike Johnson just got called out for not having a plan to deal with the expiring Affordable Care Act subsidies, and the words came straight from Marjorie Taylor Greene. Watch.
We heard from one of your members today, Marjorie Taylor Greene, who wrote this morning that on y'all's GOP conference call, she said Speaker Johnson said he has ideas and pages of policy, but did not say a single policy plan. She said, I find it unacceptable that Republicans are sitting on the sidelines doing nothing to fix this healthcare disaster that is leading many Americans into financial ruin. That's her words. She says you're sitting on the sidelines. What's your response to Congresswoman Marjorie Taylor Greene?
Well, bless her heart, that's an absurd statement. Obviously, these conference calls are monitored by media, so we're not going to have actual strategy discussions on a line where you have hundreds of people listening in.
They never had a plan, and if you listen closely, there isn't a single concrete policy idea. And just 3 weeks ago, Mike Johnson said that Republicans were not going to extend the subsidies. Watch.
Either on the Obama exchanges or are worried they're going to lose their employee-sponsored health insurance.
Yes, we have a lot of reforms that we need to push through, but the answer is not to grow government and further subsidize insurance companies, which is exactly what those subsidies do.
And then a few days later, he said that he hadn't taken a position on whether or not they should extend them. Watch.
That you, as Speaker of the House, want to see the tax credit extended at a future date. Is that what you are saying?
No, I haven't staked out any position on it yet. But
So Mike Johnson is a calm, articulate liar, the kind who almost sounds reasonable if you're not paying attention. Today he says he has a plan. 3 weeks ago he said that the government shouldn't be providing credits, and then days later he said he had no position. And these are the people you trusted to run the government. And look, Republicans never had a plan to address the expiring Affordable Care Act subsidies, and now they're scrambling to stitch something together. Meanwhile, Democrats are the only ones holding the line to stop millions of Americans from seeing their premiums double.
We worked on repealing and replacing Obamacare back in 2017. I still have PTSD from the experience. You remember that John McCain famously did the thumbs down, and effectively by a one-vote margin, the whole effort was defeated. It's a great frustration of mine, and has always been of President Trump's. And we know that American healthcare needs dramatic reform. Let's just state it simply. Obamacare failed the American people. It was promised to be a great success, to make healthcare more affordable. It's done exactly the opposite. And it has been pointed out by everyone that since Obamacare was created in 2010, premiums, the cost of healthcare, have risen exponentially. It's skyrocketed. to the point where it's no longer affordable for so many Americans.
Hi, my name is Dr. Rubin, and I want to remind you that prior to the Affordable Care Act, it was difficult for millions of people to get health insurance based on whether they had a pre-existing condition. So as an example, if you had asthma, premiums would be really high and make it basically unaffordable for many people to afford coverage, or some insurers would just not cover you. The Affordable Care Act got rid of that and said that you have to provide coverage regardless of pre-existing conditions. Now, yes, premiums have gone up over the past several years, but when you look at out-of-pocket expenses, it was actually rising at a higher rate prior to the Affordable Care Act compared to what we are seeing right now. One of the strengths of the Affordable Care Act is the fact that they were able to provide millions of more people health insurance coverage, but it is at risk of going away for millions of people because the enhanced subsidies that were put forth, not only from the Affordable Care Act, but from the Inflation Reduction Act, those are about to expire. So when open enrollment begins very shortly, many people are going to see prices go significantly higher because those subsidies have not been renewed, which is partly why the government is shut down right now, because there is a fight to try to get those subsidies back. But in addition, if we're going to just cut these things, the Republicans still have not put out a unified proposal to replace the Affordable Care Act. They keep trying to gut it, but they don't have any plan to replace it. So how are you going to do that if you've got no plan? You're going to end up costing people a lot more in their health care, a lot of headaches for everybody if you don't have a plan put in place. So that's where the issue is that if you're going to dismantle healthcare, what are you going to do to make it better?
Obamacare was not a disaster, and I really wish y'all would stop spreading that lie. And it's got to be because either A, you're too young to remember what the financial market and environment looked like back in like 2006, 2008, or you got a very short memory. I entered the workforce back in 2006, the same year I entered college, and the minimum wage was $5.15 an hour. Maybe 1 or 2 years after that, it was $6.55 an hour. At $5.15 an hour, $6.55 an hour, you were not getting insurance through the company. I remember that vividly. That premium was going to at least eat up 1 week of your check, and you only making $200 a week anyway. And you for damn sure wasn't going to get it privately because the premiums are even higher. This is why people back in the day told y'all, get a job with the post office, get a job with the city, get a job with the state, work for the government. Why? Because you may not get rich working for the government, but them benefits are going to make sure you're taken care of. But if you want to know the value of the ACA, you can just look at the benefits they celebrate. Do you know how many people were denied coverage due to pre-existing conditions? Do you understand how many people had the prices of their insurance jacked up just because they got sick? Y'all are harder on this legislation than y'all are on the companies that cause need for legislation. High premiums existed long before the Affordable Care Act. High deductibles existed long before the Affordable Care Act. Medical debt definitely existed long before the Affordable Care Act. In fact, medical debt has always been one of the leading causes of bankruptcy in the United States. The Affordable Care Act was originally meant to be a step toward universal health care. The problem is nobody else has taken another step to actually accomplish the goal of universal health care for citizens of the United States. Y'all got to start doing some research on your own instead of regurgitating these talking points that are completely unfounded.
Let's do a little fact check, shall we?
And this is going to have a huge impact. You know, as I said, Obamacare is not a good thing. It's been bad. And I'd like to make it better. I told them, I spoke to a lot of people, a lot of Democrats recently. I said, why don't we change it? We can make Obamacare much better.
So let's get one thing clear from the get-go. Donald Trump doesn't want to improve Obamacare. He doesn't want to fix it, change it, make it better. He wants to get rid of it. And he's been trying ever since he first became president, over and over and over again. And right now we're watching Republicans do it again. Let's talk about what the Affordable Care Act has actually done for Americans. Since the Affordable Care Act was implemented in 2014, more than 38 million Americans have gained health insurance coverage. The uninsured rate has nearly halved. It has dropped from 14.4% in 2013 to 7.9% in 2023. That is, for the United States, a historic low. Right now, 24 million Americans are buying their health insurance through the ACA marketplace. That is more than double the number, by the way, who were enrolled in 2021. That's because the Biden administration actually pushed people to enroll, not disenroll, like some people. Anyway, then you add in Medicaid expansion, which 40 states have now adopted, and over 45 million people total are covered through the ACA, this program that Trump says is terrible. States that expanded Medicaid saw massive drops in their uninsured rates. California dropped by 15 percentage points. New Mexico, nearly 15. Louisiana, nearly 15. But now we face the problem, which is that those enhanced tax credits that make coverage affordable are about to expire, and Republicans are blocking their extension. And that is what Democrats are fighting right now. The Affordable Care Act works. It's helped millions of Americans get covered. It has brought the uninsured rate in this country to the lowest it's ever been. Is it perfect? No, it's not. But Donald Trump has no solutions. He just wants to get rid of it so private insurers make more money. Donald Trump has never had to worry about how he was going to pay for healthcare in his entire life. For those of us who have, the ACA has been a huge step forward. Let's treat it as such, and then work to elect lawmakers who will make that the floor, not the ceiling of what we can expect.
After having watched some of the NBC interview with Donald Trump the other day, there's one part that I want to talk to you about, and that is repealing the Affordable Care Act, also known as Obamacare. Now, if Donald Trump decides to repeal it, which he already said that he would, and he tried to last time, the only reason why it didn't pass last time because John McCain and one other Republican senator voted it down, which were the tie-breaking votes, so that it didn't go through. This time, however, they have a Republican majority in the House and Senate, and we don't have any more John McCains to save us. If the Affordable Care Act gets repealed, Donald Trump said in this interview exactly what he said at the debate. He has concepts of a plan. That means no plan. So he wants to repeal the Affordable Care Act because it costs the government money. Now, if you make under a certain amount of money, you get government assistance through the healthcare marketplace, especially if you're an entrepreneur and let's say you need to get like a Blue Cross policy or any policy, any company, you can get like tax deferred help with your health insurance if you make under a certain amount.
The argument being made right now about ending the shutdown is that just end the shutdown and we'll discuss the subsidies and everything needed later. We're going to pass it. There are enough Republicans in favor of it. Like, just end the shutdown and we'll negotiate this later. And I had somebody that I thought really understood how marketplace insurance works and the annual enrollment period works tell me this, like, this is just political theater by the Democrats. And now there's no denying anytime there's a shutdown that there's political theater involved. I'm not disagreeing with that. But why we can't negotiate these later is the annual enrollment for Marketplace and Affordable Care Act plan starts November 1st. So you want me to believe that if they end the shutdown now, they're going to get all this debated and settled by November 1st so that people like me that have a marketplace plan can know what my subsidy is going to be, or agents like me, because I'm an insurance agent that also helps people select their plan and things like that, so that we can know what plan we're enrolling people in and how much it's actually going to cost them per month. There is no way people can make an educated decision about what plan to enroll in for 2026 without knowing what their subsidy is going to be. So that's from the consumer side. How can they enroll in a plan without knowing what their subsidy is going to be? Then there's the agent side. How do I guide them into what is the appropriate plan for them to be in without knowing what their subsidy is going to be? Or I select a plan for them now and then, mid-December or January 1st or whenever they end the debate and solidify it, then we all have to do the work all over again to get them enrolled in probably another plan, depending on what their subsidy is going to be, or if the subsidies even exist anymore. Then there's the carrier side. Now, I know all of us, we're mad at the carriers. They make a lot of money, but they pass off all the expenses to us. If you're a Medicare agent as well, you're feeling it now. If you're a Medicare beneficiary as well, you're feeling this right now. But the reality is they do have to plan for what their estimated costs are to operate these plans. How are they supposed to know what to do if the government hasn't even solidified what's going on? We have to end the shutdown, but we also have to solidify this. And I don't think that's going to happen if they end the shutdown and debate about the subsidies later. They have to approve the subsidies now.
Before Obamacare, when you graduated, you had no insurance. You were out on the street. Most likely you didn't have a job yet. Maybe you did. I had a 1099 job, so I didn't have a W-2. So I then had to get my own insurance. I'm like 24 years old-ish, 23, 24. I had had some migraines in college and just a few spatterings of issues here and there. And when I was on my parents' insurance, and when I asked to just like keep the same plan, they denied me due to pre-existing conditions. I applied to several other insurances, all denied me. And I was like a pretty healthy young adult. I just had like migraines. So the only thing I could sign up for was what's called a catastrophic plan. But those plans are like notoriously, they're kind of scammy sometimes. They don't kick in very fast. You don't get much care. So basically, I spent a few years like without solid health insurance, just like hoping nothing happened, hoping nothing went wrong, paying out of pocket for any kind of medication that I needed. Eventually, I got a W-2 job and then I got insurance. So fast forward to a few years later, they have Obamacare. Things that changed in Obamacare. No more denying people for pre-existing conditions, which is so cruel and evil. Like how that was a thing, it's just choosing money over people every time. And, you know, an unregulated business will do that, functionally speaking. They helped women get access to important care. I know for me as a young person, that was really, really vital because I needed, you know, to go to the OBGYN and do all the things that you do. Thank goodness there was like things like Planned Parenthood that women could get access. But before that, like, it was really tricky. You had this situation where when it started, like almost everyone had to have healthcare. It was kind of like car insurance, actually. Like everyone had to have it. And what that did was make the rates really low. And that's why it was affordable, because when you have a bigger population of people, then it drives down the rates. So more people are insured at a lower rate. Then Trump came around. So he said, okay, well, I'm going to take away this mandate that says that you have to have insurance. And what that did was make the pool of people insured go down. And when that went down, the prices went up, because the more people that are paying into the system kind of helps the systems, or at least at that point, helps the system sort of stay affordable, because it's like, again, it's the reason why car insurance is actually kind of somewhat affordable, because it has a large pool of people paying into it. And so now the prices go way up, but then COVID happens and they really wanted people to be insured. And so they created subsidies to help make it affordable again. Now these subsidies were up for renewal this year. They chose not to renew it. So that means all these people for the past few years, like myself, who got laid off but still need health insurance because I have critical medical needs, have to use this one system. And now it's going to double, maybe even triple in price. Like, they have the money. I mean, they literally have the money to pay for everyone's health insurance. Like, it's a drop in the bucket. They don't want to do it. But that's another TikTok. Right now, we're fighting for these subsidies, which are totally important for people. If you are using the marketplace, it means that you either are laid off, you don't have a job, or you have a business that can't afford to provide healthcare, or you're a small business owner and this is how you get care. There's no safety net otherwise, really. So this is why we're shut down. This is why the subsidies are important. And this is why Obamacare is important. And frankly, I think Trump has had maybe 9 years to come up with some better idea that he hasn't. And so, unless there's a better idea out there, we need to take care of the system that's in place instead of trying to ruin it.